Hello everyone, I am Dr. Sudarshan, working at Medicover Women and Child Hospitals, Visakhapatnam. Today we have with us Dr. Jyoshna Pratty, consultant acute and general physician, who also has a special interest in diabetes and endocrinology. Hello ma'am, good afternoon. Ma'am, what is the importance of health checks and when should one start worrying about them?
Okay. Hello everyone. So today we'll just briefly discuss about why we are supposed to do a health check. A health check can sound very simple, and whenever we find any abnormal result of a general screening test, people might take it lightly. But what one should bear in mind is that whenever we see such diseases like diabetes and hypertension or high cholesterol levels, which are the diseases of our current generation because of our sedentary lifestyle and work and whatever the environmental atmosphere changes we are facing. So these can lead to adverse events and complications further on if they are not treated on time and properly. So we see a lot of complications arising from these lifestyle disorders. For example, diabetes, if untreated, can give rise to macrovascular complications, we say, which is like stroke, a heart attack, etc. And similarly, we can see microvascular complications, which is nothing but involvement of your end organs in body. So eyes involvement or kidneys involvement. So these can create further complications if left untreated. So as we say, these are silent killers and they are best identified when you go for a general screening test at an appropriate age. So we would normally recommend that you should start worrying about your blood pressure, your sugar levels, or your vitals when you're reaching around 40 years.
Thank you, ma'am. Ma'am, what does health check normally include, and are there any specific health checkups which you would recommend?
So nowadays we are seeing a lot of health check packages being advertised all around. So normally when you get it done in a hospital, they normally include a physician or a doctor consultation along with the basic screening investigations. So this would normally include a blood workup, which includes your complete blood count, renal function test, liver function test, your lipid profile, your thyroid profile, etc. Along with a screening test like ECG, an X-ray and an ultrasound of your abdomen. And specifically, I would recommend if there is any family history, for example, in the family running about heart diseases, for example, or high cholesterol levels, we would normally recommend for you to go to a further investigations like a 2D echo or a treadmill test, which are seen in some specific health check packages for cardiology patients. And in women especially, we would recommend an additional investigation like a mammogram or a pap smear. So these are screening investigations for breast cancer and cervical cancer respectively. And once a woman starts reaching around age of 40, and if you have a family history of breast cancer, these are recommended to be done at regular intervals depending on what risk factors you have. And if you are known to have high risk or if there is a family history of a genetic mutation being positive, then definitely you would be advised to have a mammogram annually at least.
Ma'am, what diseases can be identified by investigations, and what in general do we say a screening? How important is a screening investigation?
So in the health packages, normally we can identify diseases at an earlier stage before they start presenting with any symptoms. So for diabetes and hypertension, for example, these normally don't have any symptoms until they're left untreated for a long period of time, or when the patient lands in a severe illness state or ketoacidotic state, for example. So when we see impaired fasting glucose level or when the sugar levels are borderline, that is what we call as pre-diabetic state, we would recommend different measures like lifestyle measures or exercise or diet control, which are highly beneficial in that period of time. Once that diabetic stage is reached or when the patient starts developing complications, we probably have missed that boat. But we would still advise them, but it is that crucial window which we are looking for. So I would say early detection of diseases like diabetes, hypertension, or be it fatty liver even, when you recognize that in early stages, we can give better advice to the patients and prevent development of complications like cirrhosis and other illnesses arising from it. and even identification of early coronary artery disease, which can be thoroughly investigated and treated better if identified earlier. So these are a lot of advantages in having regular health check for yourself.
Ma'am, what should one do after having investigations or health checks done?
So normally we see that most patients they get their investigations done somewhere, and they try googling their symptoms or treating themselves. Or maybe a family member is already taking a medication for diabetes or hypertension, let's say. And if there is anything abnormal in your health check, I would highly recommend for you to see a medical professional rather than treating yourself, because there is a reason why one pill does not fit everybody. For example, if a tablet is suitable for your father or mother, it might not be suitable for you, for your age group, etc. So when a physician recommends a medication, they consider a lot of factors while prescribing them. So I would say once you get your checkup done, please consult your physician or the required health professional.
Thank you, ma'am. So today we got to know the importance of health checks. What are the various health checks that are generally conducted, and what is the worrying factor in health checks, and what can we do after the health checks? So thank you all for joining us. See you again with another doctor and another disease. Thank you.